10 years ago, I started getting like tension headaches, almost like a feeling like a band was around my head.
Classic description. Okay, this is your atlas up in here, okay? Now when I take you this way, I don't know, you feel pretty good. There's a little bit of a blockage on the left, actually. Now, how does the jaw feel when I do this?
Feels relaxed.
Okay, no pain, nothing. Okay. You okay? I'm going pretty aggressively here.
Yeah.
Right through. All right, so that was C1 and C2. Moved just fine.
Okay.
Anything?
No.
Next side. Here we go. Chin back. Oh, this side is locked. I got you. Think thoughts right here. There you go. That's all I do, okay? Now just stay there while you keep a curve in your neck. I'm gonna do your feet.
Okay.
Any pain when I do this?
No.
Ooh! Okay. Next one. Let's see.
Does that tell you anything by
Yeah.
the way my toes crack?
Tells me where you're placing your weight.
Okay.
Anything you're doing okay?
Yeah.
Whoa, that moved nicely. Stuck. Oh man.
Yeah, this left leg, like I said, is always
Yeah.
one of the tight one.
Reach overhead and grab the table for me. Hip socket. Moves. It's hypermobile, your hip. You're right.
My left one?
Yeah. Keep holding. Hold on. This ankle moves just fine. Knee is fine. Hold on for me. That hip moves just fine as well. Your joints move just fine. This leg up straight back as high as you can. Just testing pelvic alignment and down. Good. This leg. Not as well. Okay, and down. And this side as high as you can. Got some spasms to give, and then down. And this leg. It's a little bit of a struggle. Okay. Now that is also 80% of the population. Nothing unusual there, okay? Most people have more range of motion in this side than this side because of the way their pelvis, their sacrum tilts, okay? Deep breath in and back. Okay. That is fine. That moved just fine. Same thing again. I'm sorry, P to A. And back. Here we go. Deep breath in. And out. Yeah, P to A, lateral to medial, superior to inferior. Perfect. And again, deep breath in. Oh, come on. Yep, good. And all the way up. Just taking both of these ribs. Drive them down. Okay, that was your that's your upper thoracic. This feels a little rib out here, but it's not bad. Oh, you're good.
Nice.
Take your leg up. There you go. And that's tight.
Yeah, it feels pretty tender.
Can't quite get into that one.
Pretty tender.
So it's interesting. Okay.
Is that like the injections they give like football players? Their backs or whatever?
Yeah, it's just the way it is. Okay. Very good. Feels good. Okay, I'm gonna do the scraping. Here's this. A little bit there. Okay, that was a lumbar. We don't find as much usually in the thoracic.
Mm.
Call it whatever you
Gritty.
want. Yeah. There's a piece of scar tissue, okay. An adhesion. So we have petechiae coming out.
Is that the same term you use for the circles that get left when you do the cupping? I would think it would be because it looks kind of the same.
One's a hickey and suction, so drawing up blood. This is actually passing an object through the fascia and blood coming to the surface.
Yeah, I
So
guess
when
one you're doing reverse pulling and this one you're pushing.
Mm-hmm. It's like a comb. Think of it more as a combing through fascia.
Yep.
There's Sorry. There we go. Tuck your chin for me a little bit, as long as it doesn't hurt you.
Mm-hmm.
There you go. Okay, raise this arm above your head for me. Just like to there. There you go. There's a little spot over here. Doing good. Are you okay like that?
Yeah.
Okay. You okay?
Mm-hmm.
A little ticklish?
No. Well, yeah, I'm ticklish, but that is not tickling me.
Okay. Oh. Looks good. Okay, you can lower that arm down. Let's do the other side. Starting to see why they work on this side.
What are you seeing?
Superficial scars.
Stuff that's not very deep.
Right, exactly. I didn't feel it with my elbow on the green roller because that's not what that's for. Yeah, here we go. I even pulled it, you know, I didn't feel it. This one behind your back for me. There's something underneath the scapula. There you go.
Yeah, this shoulder I have way less, not way less, but
Like when you...
range of motion than my left.
Okay, yeah. It's not because of the rib cage though,
It's
which is
not.
usually the main culprit.
Yeah, like if I were to put my left arm behind my back right now,
Do further.
I could touch like my right scapula. Like when I do this
Right,
one, it's
right. I
really
see
like
that.
a struggle to bring it all the way up there.
Oh, you're doing pretty good. Yeah, but it's not deep, and it's not the shape of your spine. So
I think
it's like,
a lot of it,
what the
not
heck?
a lot of it, but some of it's coming from like tight pec minor maybe.
Could be. All that stuff. You just need a once over every once in a while. You're doing pretty good. You need somebody to clean you out once a month.
Mm-hmm.
Stick to your yoga. Your body, it takes a couple of years to heal. To start healing happened whenever you went and saw that guy, okay?
12 months ago, yeah.
You know what I mean? It takes a couple of years to fully heal.
Yeah.
It doesn't happen overnight.
Especially
And the older we
10
get, the longer it
years
takes.
of just being
Yes.
so freaking.
Yes. He doesn't have to do this if he doesn't want to. I like to do this stuff. I like this being done to myself. I feel like I have more in range of motion when I have this done.
Mm-hmm.
So I do the things that I like. It's worth a shot. All right, this arm over your head now. Just like we had it before. Yep, let me get under the scapula. There you go. Ooh, that sun coming in. Yeah, it's a lot more petechiae as far as the bruising.
On the side.
Yeah. Like there's been some sort of...
Is
They're
that-
taking care of you.
The bottom, like right corner,
Yeah.
does that seem more?
Right here is where all the petechiae came
That's
out.
where it's all going on. Yeah,
Yeah.
because whenever like I've seen pictures of just my hands like hanging on the side of my back,
Mm.
and it's like I got like a almost looks like I have like a lump or something that like sits right there.
No, you're fine. I'm telling you, I don't see anything that I have not seen before.
Oh, that's good to hear.
Do you know what I mean? I'm not finding like, oh my God. Now,
No,
maybe
yeah.
a couple months ago I would have said it.
Just from seeing the video, I only watched a couple, but yeah, those people,
I'm starting from the very beginning. You know what I mean?
We're way.
Very good. Now just roll those shoulders back and around. Let me see if I see anything. Sorry, I forgot about the mic. Yeah, and back. I'm looking. I know, let me move this mic out of the way. I'm looking to see if anything is catching at all. Yeah, you can touch the inferior border.
I would struggle a little bit more, but
Yes, but it sits higher. You have to understand that.
when I do this too, I feel
You feel it on the
where I'm
front.
getting stuck is the front.
Okay.
Yeah.
All right, on your back. You want to see it? You want to take a picture of it first?
Sure, why
Here,
not?
I'll wipe you off.
Oh yeah, I can see where there's more out there on the right side, and then the left side more like the center.
All over, kind of dispersed.
Yeah.
I know. I wonder if I can.
What
Shut
is
this
this? Is
off.
what I was talking about. Like, so that like little.
Nugget under here.
Yeah.
Yeah. Here, I'll show you. Take a seat. I
And
gotta
obviously, like the left side doesn't have that.
see if I can't settle the camera correctly. Did I do this one on you? I can't remember.
No.
Elbow back into mine. You gotta press.
Sorry.
It's
So
all right.
like that.
Yes. Shoulder feels fine. I'm gonna do the other one now. Press your elbow back into mine. Okay, there you go. Relax. You have great range of motion. Okay. Where is it? You've got it under here, yeah, big time. Oh. I can't hook onto it. There. There it is. 5, 4, 3, 2, 1. Come at it like this. 4, 3, 2, 1. Breathe. It's almost gone. Okay. Now watch this side.
Is that my pec insertion?
Subscapularis.
Okay.
Scoot that way for me. Watch this side will not be as bad. On your hip here. Relax the arm now. Let's feel it. I lied. No, it's over here too. Feels healthier though. Take a break. It's one that's very difficult to get.
Yeah, at the spot at Rolfers, pretty much that's the only person that's ever worked in that area. And yeah, they're very busy. It's-
I'll be right back. I'm just throwing it. I don't need a minute. I would lay you down, but the sun is like weird. can do it without
It's
this.
intense.
I don't do all of this to them.
Yeah, it's definitely. Oh,
I don't know how badly I'm hurting
really
you.
tender.
I don't look at your face.
No, it's fine. It's just.
The other side. It's not like, oh my god, it feels good. You're just tight. Not badly.
Is mine pretty straight? Someone told me
You have a little curve,
Yeah, someone
but
like
it's
a little
not
tiny
bad.
bit. Yeah.
No.
Yeah, they said it was
I think
like
you're beating
super,
yourself
super
up.
minor.
Either that, or it's just that you've improved so much that I don't know. I'm not seeing much.
No, yeah, this past couple
I
months.
mean, yeah, there's a little bits here and there, but it's nothing. I can adjust it. Feels good. Yeah, your shoulders drop. Start watching people on the street and how they are.
Yeah.
They all have this though.
Everyone's like this.
But the right one will be more than the left.
Oh, the right ones?
Always.
What, more turn?
Yes, always.
Well, I think that's from just people being right-handed, though. It's gotta
No,
be. You don't
no.
think it is?
Heart's over here.
You think it's from the heart?
Yes, because the heart beats and it lifts it up. Watch a little toddler, they have it.
Huh.
Okay, a little tiny baby has it. We all are built that way. Now, if I didn't acknowledge it,
But you don't think someone that's played as many sports
It
as
makes
I
it
have,
worse.
baseball,
it makes
and all,
it makes it
just
worse.
Makes it worse,
But it's
yeah.
not like, oh, that baseball did that to you. You were
So
made
you
that
think
way.
a left-handed person
They would have problems.
still have it worse on
Yeah,
their right
they would
side?
still have a dropped right shoulder. Yes.
Hmm.
The body reacts the way it's appropriately to what it's supposed to what it feels. If you step on this foot all day long, the bottom of my foot is going to develop calcium. It's just it's what happens.
No, yeah, our bodies are really smart.
So if you
obviously.
yeah, so give your body some credit. This feels good. You just need, when you brush your teeth every day, right? Clean.
Yeah.
That's all you need. You need a cleaning. Now, it's okay. Head back for me. Perfect. Other side. All right, head back for me. Ooh, I need you way back. Perfect. Okay, great. Wonder when last time that was done.
Been a while.
Yeah, it felt a little. I was like, ooh.
Yeah,
All right, come on up.
probably more than 6 months before the
It's
summertime.
been a little bit. So I was like,
Yeah.
that hasn't been. All right, turn all the way around for me. Let's do your elbows. There you go. Feels good. Lean away. A little tight. It's okay. Good. Let's get everything moving. Get it moving. Lean away. This wrist feels better. Lean away. This side's a little bit more loose. The other side. It's fine. What now do I want to stretch. That's where I want you to work. Right there.
Like my mid-thoracic or...
Yes, exactly. You're not very
What?
flexible right at T6.
Sit
In
it.
TC, it's T7.
So doing this on my foam roller?
But you're just going to stay here. You're not going to roll. Well, you can roll on it, but you need to spend some time slowly opening up the front.
Uh-huh.
Okay, you got to open up the fascia in the front of you.